All right, so let's open the meeting. It's 6:32, Wednesday, August 20th. This is the Wakefield Board of Health. Here we have Ms. Marcy McCauley, Ms. Elaine Silva, myself. We have Melissa Lowry. We have Health Director and Anna McCarthy, the Town Clerk, Health Department Clerk, excuse me. Public participation. Do we have anybody on for public participation this Ms. Lisanne? Okay.
Okay,
Anybody
Yep.
else?
just,
Where did that person come from that I saw pop up?
There's Scott M. Scott, are you going to be speaking tonight at public comment? Okay,
No, I heard you. I'm sorry. I'm all set. Thank you.
Oh, it's okay. Okay, thank you. Okay, so just one.
All right, Miss Scott Lisanne, why don't you go ahead and share?
Sure. Okay. Before I start, I want to say that I will be providing the statement in writing so it can become part of the permanent public record. It covers a number of important issues for which the public deserves to be apprised. Do note that while I endeavor to keep my comments to 10 minutes, their complexity and details may make that difficult. Please allow me the liberty of any additional time to cover my key points and also any questions you may have. The Attorney General encourages public bodies to allow as much public participation
3 minutes.
as
It's
time
usually
allows.
3.
Miss Lisanne,
I understood.
pardon me,
10
before you
minutes.
start, excuse me, Miss Scott Lisanne, I'd just like to remind you that usually public participation is limited to 3 minutes per participant. So take that under advisement. We may have to stop you if you go beyond 10 minutes.
Okay, well, do understand, I understand with other meetings, it's 10 minutes?
This meeting is 3 minutes.
Usually do 3, yeah.
What was that? I'm sorry?
This meeting is typically limited to 3 minutes. I will allow you 10 minutes since it seems you're our only participant, but please know you will not be able to go longer than 10 minutes.
Okay, thank you.
You're welcome.
Anyways, I will begin. I'm going to be as concise as possible, but it's a somewhat complex matter. I feel the town of Wakefield is dropping the ball in protecting its citizens from foodborne illnesses. It is not transparently making restaurant inspection reports fully public to consumers. They are hiding behind public record requests versus fully available for viewing by consumers. We can't assess the risk of food poisoning from any of the town's food preparers based on our individual health considerations. We need that access and transparency. It is essential to your job of effectively serving and protecting and promoting public health. Please note that I am passionate and knowledgeable about this issue as someone who takes multiple immune suppressing medications, as a parent who cared for and advocated for a child who is a bone marrow transplant survivor, and as someone who cared for an ailing elderly parent in her home, and as someone who advocates for people with rare autoimmune diseases that are treated with strong immune suppressants and chemotherapy. I am also very immune suppressed and have suffered foodborne illnesses and sepsis requiring a long hospitalization and rehabilitation. Of course, we need to consider the very young and pregnant women who also face increased risk of foodborne illnesses. On the heels of the Bamboo House 2 years ago, due to long-standing food safety issues, I prodded the town to post the food inspection reports in the town website. Note that I heard about the problems through social media. It is scary that I actually died there frequently but had no knowledge of any risk. The online postings of restaurant inspections were finally put in place by the former town administrator, Steve Mayo, almost 1 year ago. However, there have been no updates since last fall. Additionally, it is problematic that until I formally filed an open meeting complaint last month that the town and state, the Wakefield Board of Health meeting minutes were not posted to the town website for many months. Until then, the last meeting minutes were posted for the August 21-24 meeting. The agenda for the June 2025 monthly meeting is still not posted as required by law. I must say that it is surely not exceedingly difficult or time-consuming to paste PDF files into the town website. The badly out-of-date meeting minutes issue was previously reported to the public comment period at a prior Board of Health meeting, as was the need to include more detail on meeting agenda publics. Under open meeting laws, agenda items should be specific enough to give the public an understanding of the matters to be considered, avoiding broad or vague terms. Broad categories such as Health Director Report offer zero insight on content, and simply stating rodenticides for the March meeting offered no context about a possible new town bylaw. There is not enough agenda detail for the public to consider participation. In the case of the April meeting, the Health Director Report covered previously undisclosed longstanding issues with Sakura, a restaurant my family also frequently frequents. We recently dined there just last month. There was no way for myself as a member of the public to anticipate that important topic. Additionally, Town Council member Jonathan Chines, who was a liaison with this board, brought up the issue of unposted minutes with the health department. The explanation was that there was no clerical support and that it would be fixed ASAP. Yet months passed with no updates despite a hire being made. Do note that uploading PDF files to a website is not at all difficult and time-consuming. However, it must be done in a timely manner according to state law. As already mentioned, the April 25 meeting agenda did not include that there would be a discussion about ongoing and undisclosed food inspection problems at Secura. Repeated issues with the establishment have still not been fully disclosed to the public by the online posting of inspection reports. It was not until the April 25 meeting minutes were posted 3 months later at the end of July that any disclosure was made to the public. It covered, bear with me here, it covered serious issues, including rodent problems and unsanitary conditions that had been ongoing for months. I was appalled and dismayed by the findings, and that again, the public was not fully informed. I honestly don't feel citizens are being well protected. Because of that, I have lost confidence in the health department and the board. Meeting agendas require more details. For example, the health director section needs to include the specific topics to be covered and should always include a discussion about the status of food inspections and any other outstanding issues. This transparency is necessary to fully protect the public and empower them to do business with restaurants that take food hygiene seriously. This would persuade the restaurants to improve their practices because their income and permits would be in jeopardy if they don't. Additionally, the posting of restaurant inspection reports on the Health and Human Services section of the town website are now badly out of date. There is no way for consumers to know of any food preparation or hygiene issues by any of the food preparers that serve multiple populations. Depending on the risk level of possible exposures, food inspections are to take place as often as 4 times annually. Consumers can confirm the inspection results of, or if regular inspections are being completed as prescribed by the state and federal government. No new inspection reports are posted for 2025, and the last ones have fall 2024 dates. Some annual inspections could be overdue too. In Massachusetts, they are to take place at least every 6 months. There is no way for citizens to know, and if food inspections must be a regular part of the board's meeting agendas in the critical area of their oversight and management. At a minimum, informing diners can happen through the town website that Steve Mayo championed a year ago, but posting updates were not maintained. Other options are posting grades at restaurants and issuing press releases and social media reports through local channels. This transparency empowers consumers to make informed decisions about where to dine based on the preparer's hygiene practices and their individual and unique health considerations. Food inspections are public records, hiding now from behind the barrier of public record requests. This does not serve the public interest or support public health that is best served by full transparency and the ready sharing of information. This access also helps persuade food preparers to perform better because bad reports will discourage customers from choosing them. This will affect their bottom lines because they lose revenues to better performing competition. That is the best way to encourage compliance and a valuable tool for you as regulators. On the heels of the permanent closure of the Bamboo House 2 years ago, that, as you know, I also frequently dined, I continue to prod the town to post the food inspection reports in the town website. I thought it was in place by the former town administrator, Steve Mayo, almost a year ago. However, since then, there are no updates. There is no way for consumers to gauge where they can safely eat. This does not reflect well on the town and its restaurants. Openness, accountability, and improved communications can boost health and trust. They are greatly lacking now. I include here some research I did supporting public disclosure. Also includes a public policy statement from the National Environmental Health Association, as well as the statements by the FDA and their food code.
Miss Scott Lasan, 1 minute, please. One more
Okay,
minute.
Yep, I'm just summarizing 2 other pages here, as well as the National Environmental Health Association policy statement about point of sale food inspections. And I want to add that there's also concerns about safe recreation at Lake Quannapowitt. The notices about the cyanobacteria are not effective, the ones that are posted along the lake, as well as the PFAS fish contamination. We do have people that regularly fish there, including Asian families that consume carp as a regular part of their diet. So the town needs to do a better job of getting that word out about the condition of the lake, including the cyanobacteria and the fish. I believe that you will probably at some point be hearing from the Friends of Lake Quannapowitt in regards to the cyanobacteria in particular.
Okay, thank you, Ms. Scott Lysan. I appreciate your participation.
Do you have any questions?
I don't have any questions. Does anyone else have any questions?
Not at this minute.
Okay.
Or takeaways? No takeaways?
No, thank you. We'll take all the points you shared under advisement. I appreciate you joining us today and participating and preparing a statement. And I appreciate you sending it in to be part of the record as well.
It needs to be. It's important. It's important for the citizens of the town, and it's important also for your accountability and to look like you're doing what you need to be doing.
Okay, thank you.
Okay, thank you.
And no other public participation at this time?
No.
All right, so let's close public participation at 6:45. Why don't we move on to the minutes from May 21st? They look great, Anna, thank you. Any thoughts, the addition?
I don't think we've had a June, July meeting.
That's correct. Yep.
No.
No,
This
it
was
was
our last
June, I
meeting.
meant June that there was, the agenda was missing.
There was no
There was
meeting
no
in
meeting
June.
in June.
Oh, really?
Nope.
Okay,
No,
there
we
was
didn't.
confusion by the website before then. It looked like there was one in the previous
have a-
version of the website.
We do have a new website that's launched, so things
I
may be
know that.
migrating incorrectly, but June and July, I don't believe we met, so.
Okay, it made it look like there was a meeting in June at one point.
If anyone would like to make a motion to approve the minutes.
I'll make a motion to approve the minute.
Second the motion to approve the minutes. All in favor?
I still.
Linehan, aye. So moved. All right. Did I understand that Joe will not be joining us? That-
Yes, we were scheduled to discuss the permit for Joe's Ice Cream. Actually, Marcy, you may not have been here for the first part of this, but 2 years ago, I believe it was 2 years ago, there was an issue with Joe's Ice Cream permit here in Wakefield. There was an issue with altercations, with with behavior issues. The board worked with this vendor. English is not their first language, so we were able to kind of talk about ways to mitigate that. With devices, we have translation devices that we had ordered through the department. We actually ultimately gave one of these devices to this person in the hopes of de-escalating in the future if anything comes up. This vendor did hold a permit in multiple other towns, in surrounding area, including Stoneham, one of our towns here. Recently there was an altercation in Stoneham, and so.
Is that for a truck type permit? Yeah.
Oh, it was ice cream.
Yeah, it's
Yeah.
Okay, okay.
Ice cream truck, yes. Maybe about a year ago in Stoneham, we actually revoked their permit. Not related to this board, but the Stoneham Board of Health had decided to revoke their permit. They are seeking a new permit here in Wakefield. We had originally, as a department, we had denied their permit application because of past issues and because of knowing of other altercations in the area. But as they're right, they are appealing it to the Board of Health to consider their case. And so they couldn't make it here tonight, so we're just gonna put them on the September agenda.
Okay.
We'll present more information and then they'll also have a chance to present as well. September meeting.
Anthony, do you want to give your health director's report?
Sure. So we have two new hires in the region. We have a new regional public health nurse. We're very happy to have him. His name's Ty Wind. He is joining us. He'll be serving the 6 communities in our grant. Melissa is one of their primary trainers. So it's helpful to have a lot of experience to teach one of our new public health nurses. He'll be coming around to meet boards as when possible. So he'll likely come to the next meeting to kind of meet this board, talk about things he's learned. We'd love to hear a little bit about your experience, Elaine, teaching the next generation of nurses. But yeah, so we're excited to have him and a new inspector trainee, Liana Chan. She joins us for our 3rd iteration of the training program. Our training program has gone very well. Thomas, Michael, Shelby, Josh, a lot of our trainees in the past have gone on to full-time positions as inspectors. We've actually retained 2 of them, Shelby and Thomas, in our towns. So we're very excited to have Liana join us. We're only having 1 inspector training this time around because it's more manageable for us to train 1 person at a time. They'll get more kind of attention, one-on-one attention from Dan, as our trainer. But she's hit the ground running. They both have the first 3 weeks has gone very well. They've gone through a lot of trainings, just kind of online learning to kind of get that basis built up, and then they'll be going out. They've been going out to the field already, doing a lot of field training. So we're excited to see where they go. Great. In terms of food inspections, this month has gone very well. We have not had any concerning food inspections. We do plan to follow up with Socorro soon. They do have a food safety consultant, so we're confident the food safety consultant is working well with them right now. But we do plan on bringing an update to the board next month. We're at this time going back to the every 3-month schedule for them because they do have a food safety consultant keeping track. So, so we'll provide more information at the next meeting. We did, between the last meeting and this one, we did issue a public health advisory about the cyanobacteria at Lake Q. It is visible right now. So what happens in this process is once it's becoming visible, we do issue a public health advisory in conjunction with DPH on the state level. We go out periodically now to go survey the lake to see if it's still visible. If it becomes less visible or it dissipates, then our job is to then contact DPH and they'll send out a person to do the water testing at that time. Their process is they'll test once after the cyanobacteria is cleared up, and then they'll test again a week later. And so what they're looking for is a cell concentration in the lake to see if it has decreased below the dangerous threshold. That hasn't happened yet because we can still visibly see the cyanobacteria in the lake. We have spoken to many user groups, given them information. So the Boys and Girls Club, summer camps, the boating camp on Lake Q. We have spoken with them. They did suspend activity on the lake for about a week, but they were working with their counselors, working with their kids and the parents to understand, what the issues might be. And so they know the protocol. If they fall in, they are to wash off completely and to monitor for symptoms, and to go see their PCP or urgent care if they do have any symptoms. So
Are there signs?
there are some signs around the lake. Jen McDonald also has been great about helping us post this online and through the social media, Facebook and other places.
Can I chime in about the signs? It's
Leslie-
important to note
Leslie, can you?
that these signs
you
are
have not
8
public
foot
comment?
high and are not legible. And there's
Okay, so I think we need to talk with public comment and let them know that there is a process for commenting. Only during public comment can they come in. So.
Yep. Ms. Scott-Lisan, I appreciate your comments, but please, this public participation part of the meeting is now complete.
Please know the signs are not legible. They're too high.
Understood. Thank you. Please respect our rules and keep your public participation to the beginning of the meeting.
So we are gonna look at maybe new signage around the lake.
Okay.
But I think one of the things that we've been good about has been reaching out to common user groups in the lake.
Yeah.
So,
And maybe if we have signs, making sure they're at any point of like access to the lake, right? They probably don't need to be
Yeah.
places where people really aren't accessing the water.
I have a question about the signs. Are those the signs that we used in the years past?
yes.
They are, right, okay.
And the advisory that was issued last year about Lake Q, it's really not safe to eat much at all out of Lake Q.
Ever, right?
Really ever, but the threshold is no more than one fish every 6 months.
Mm.
Okay.
Still not a great idea, just from a health perspective, probably not great to eat fish. So.
Okay.
If we do see or we hear of any other issues with people consuming fish regularly out of that lake, we will let you know, and we will try to put out more information on that.
Okay.
But we don't recommend eating fish out of the lake.
Do they have to have a license to fish here on this lake?
I think if you're
From
an
the town?
adult, if you're over a certain age,
Stated?
If you do, yeah.
All right, and who monitors that? May I ask?
Fish and game, I believe.
Fishing game too? Okay.
Yes. So if we do have a concern about somebody doing that not legally, we should probably report it to Fish and Game.
Mhm.
And friends of Lake Q have been in touch. We have had good discussions with Rachel Gladstone from the Department of Public Health. She is the kind of authority on cyanobacteria.
Mhm.
She's been very helpful. She provided us with the templates for communication with the public. So
Cool.
And then the final piece, I'll let Melissa get into the nurse's report after, but the final piece is that the board was very good about working with us on passing bodywork regulations. And so we will be looking to enforce that more thoroughly moving forward. We do have a good partnership with Massage Licensing Therapy Board, just because I also happen to serve on there. So it's been good to kind of hear what their processes are, how they go about investigations. It's been kind of eye-opening in that sense. And I've also had a chance to talk with them about what the overlaps are between bodywork and massage, something that, if you're at that kind of higher state level, you may not see that connection, and it's hard to distinguish, right? It's hard to distinguish between massage and bodywork at the local level, and so I think just by bringing attention to this issue of this gap in the state regulation of massage and bodywork, I'm hoping that one day we can bridge that and either give locals more authority to enforce across the board, or we work with the state and really give authority to the state to regulate all of it. So, but in the meantime, we're looking to enforce our local regulations. So.
I thank you for stepping up to be on that committee. It's a very, very delicate committee, and it's been one that we've been pressing in public health for many, many years to have somebody really and truly define the difference between what is what and who's going to take care of it.
Yeah.
I thank you for doing that. I really do.
And then last piece is MHOA. We will be attending MHOA again this year. We are lucky enough, so you guys haven't met her yet, but her name's Ruha Patel. She is our regional epidemiologist in Melrose, but she works for the 6 communities. She'll be presenting a topic, just selected to present a topic at MHOA this year on TB. Which is a rising issue throughout the state. And so we're very proud of her at her first attempt to present at MHOA. And so she will be there alongside some of our regional partners. Myself and Maureen will also be there. We'll be presenting on nicotine-free generation.
Oh, good.
So we did a talk last year about this topic, and since then there's been great progress. And so we're looking to do a second part, kind of updating everybody on where are we now and what the next steps are and how they can implement their communities if they're interested. So MHOA is in November, and so hopefully we'll get some more information to you guys. But we're happy to see that MHOA is expanding their scope a little bit to include topics like TB, which are important to a local health department. So, yeah,
cool. Sandy was away part of last week, so I was covering, and I just wanted to sort of brief you on cases and what she's been doing. We had a pretty serious babesiosis case. The person was hospitalized for over a week. Just totally sort of out of the blue. She had been vacationing on Martha's Vineyard. And most of the cases we are seeing are coming from Nantucket or the Vineyard.
What's the illness, Melissa?
Babesiosis is a tick-based disease, and it ends up having a lot of kind of flu, achiness, like symptoms. You could get very high fevers. This particular person had a fever of 105 when she was in the hospital. They ended up packing her in ice and
Wow.
things.
How old was she? Like an adult?
50 in her mid 50s.
Okay, an adult. Wow.
Yep. And so, yeah, there's been a lot of different types of tick-borne diseases. They're on the rise. So we're trying to do a lot of education to people because of them being outdoors, walking in the woods, vacationing in New Hampshire and on the Cape, and just so that they are aware. And there's a case of cryptosporidium, waterborne parasite, and that was not nearly as serious, but you know, just to be aware of that. There have been 2 Legionella cases, and 2 very different ones. One was from a Santa Fe scientist. Both of them were hospitalized. One is out now. The other person is a Harts Hill resident, and he's still hospitalized.
Wow.
So they're not connected at all. So there is no cluster, but we're still sort of watching and waiting on that to see if we can find out anything. Sandy's been doing, there's one more case that she just got today, a salmonella case, and she reached out but has not heard back yet. There have been a number of COVID cases. It's trending up again and will be for the fall. And, you know, in response to that, we're not getting a lot of support from the FDA and the health departments nationally about vaccinations. So I think we're going to have to do a lot to remind people that it may not prevent you from getting COVID, but it certainly can vaccination can lessen the symptoms if you happen to have COVID. So,
The hospital.
Yeah.
yes, absolutely. So we are not in these 3 communities offering COVID vaccine because people were not asking for it. They were able to get it more rapidly at CVS and Walgreens. And so because it requires special cold freezers, it makes it a little more difficult. But you know, if for some reason the request would go up, we would consider doing something about that. Flu clinics are almost upon us. So we're starting to plan for those. Sandy has 3 clinics already set up, and I sandbagged you guys early on. It is, the date is Saturday, September 27th. There is the farmer's market and then the town day.
You do
So,
flu clinics at both? Okay.
yeah.
Hoping town day is a little drier than last year.
Yes, absolutely.
Challenge you. Let's have some snow.
Go Wayne, shut your
Bring it
mouth.
on.
Great date on the 28th.
Okay.
And then in addition to that, Sandy has been doing a lot of working hard to get the Narcan boxes up in the town buildings and being available for training. She's done some training for some groups where she offered training here, trained a few single or 2-person training sessions, and then she's nailing down a date. The water department wanted her to come at 7 a.m. So she's willing to do that. So,
We also got a good training at the senior center too.
yes.
How long does the training take for her to give it?
Well, she's very thorough. I would say half an hour,
Mm.
but we include in that time, time to work on a CPR mannequin.
Okay.
If you have,
Half an hour is not so bad.
yeah,
It's not bad.
it was originally an hour. It's been cut back.
Yeah. Yeah.
She's providing Narcan to the schools, working with Carrie Melanson, who is the nurse leader there. And providing her some support things, and is available for training if needed there. And that's really, I think, what's been going on. Next week, we are getting together with Chesia Robinson, who is the nurse leader for the Northeast region, for an all, first, we're going to meet with her as the 3 communities. And then on September 3rd, we're getting together as all 6 communities to meet with her. So that's coming up.
Have you had many inquiries as to the nasal, the spray mist coming back and people ordering it and having it delivered? Their
Like flu?
insurance is,
Mhm.
yeah, the flu, nasal flu from AstraZeneca. I don't know if you haven't seen the commercials yet, Anthony?
I have seen the commercial.
Okay.
We haven't received much.
Yeah, you haven't.
Do we have our
received it?
vaccine?
No.
It's coming next week,
Yeah. I know we don't do.
but no flu
Flu
mist.
mist. We don't do the flu mist anymore. And I was wondering how many people were really and truly inquiring about it, why we didn't, because we did as health departments for many, many years. We got it, but we don't anymore. And I don't know if you were aware of it, but they're shipping it right to your home. And yeah, I watched the little video today that they had on TV because,
People
me,
self-administer?
they're self-administering it. I was very, very panicked over temperature control because there has to be in a temperature, and I've seen flu mist delivered that wasn't right temperature, or was questioned and you sent it back. And the guidelines are ages, 3 to 49. And you can't be immunocompromised. And at one point years ago, it was if you did receive it, because it's a live vaccine, that you shouldn't be near anyone who was immunocompromised, and it's not to be given, not recommended for pregnant people.
Or
So
like people that could become pregnant?
yeah, well, after they got it, I know it works. I've seen the data and I've seen the patients, okay? I just wondered if there were people inquiring why we didn't have it, where insurance companies are paying for it. Because I know like we've had many questions sometimes in public health departments, and mostly they've mentioned at the meeting that they may ask. Years ago, there was meningitis where you could order it, your insurance would pay for it. They'd send it to the pharmacy, and then you, as the patient, would have to go pick it up and bring it to your own primary care. So I was wondering if people were asking about things like that, because I thought of that. I mean, it's an easy administration to do. It really is, but me being on that worried side, I guess,
Yeah.
I worry about the
That
people
way
and the ones that, you know what I mean? And
Doing it correctly. I
Yeah.
have not had one
Yeah.
call.
yeah, I was wondering if people were, I was
And I-
very, yeah.
And Sandy and Heidi have not mentioned it to
Yeah,
me.
it's just weird. It's so blastful on the TV.
My
know.
question is, how will you know then? How are they gonna record it in MIIS?
I think I tried to get an answer, but supposedly once I think the insurance company sends it to you, are they gonna just assume that you did administrate it and put it into MIIS, or are they gonna have to report something back? There's no question on that. And I was wondering if we could get a hold of one of those, I'll ask Karen if she can get a hold of the rep that she gets hers off of and find out, because I mean, that's one of the biggest things when you come in for a flu vaccine. How do I get my proof?
Right.
Can you give me a letter, or they just go into MIIS? So if they're self-administrating it, who's going to be the administrator? It's not going to go through color.
Unless like, does the patient have to scan a QR code or something?
Yeah, I'm wondering. That's what, it's odd. And how many are they going to ship? I mean, you got a mother, it's the greatest thing for children. Do your kids have it?
No, they've never had it, but I've had to dive on top of my child to make sure she gets the
Yeah, well,
actual
yeah.
vaccination.
I
It's
have
harm.
two grandchildren that did.
Yeah.
When they stopped
pretty.
giving flu
Yeah.
mist, I have two grandchildren who didn't talk to me for almost a year because they had to get a shot. They
Yeah.
were very upset.
Yeah.
But,
And the
it's-
efficacy is there, you're saying?
yeah,
that you've
yeah,
seen the data?
and yeah, I've seen it and I've seen the people. We used to give it out every year. They were never sick and they got live vaccine and people swore by it, you know?
Mm.
And the sad part was when we stopped it here in the United States, it was Canada who said, why would you do that? It's good. And that's why it's come back. Do you remember we went to, were you there? Yeah, when he came last year, the guy that replaced Lenny, he's very, very good. I think I still have all the information on it, but I was just wondering if people were asking us, you know,
Yeah.
why don't you have it if an insurance company is covering it, you know?
They have not been asking, and I just worry about whether or not parents are able to administer it correctly.
It's true. It's we're like
Forming-
putting it in, exactly, a
Yeah.
moving kid, like, yes, a
Yeah.
vaccination is hard, but there's a technique that also has to happen, like, you
Yeah.
gotta get it in them.
Yeah, it's easy. It's easy to do. You only do one side. It only comes out on one side. You know, you do one half of a dose, you take off the little clip and you put it in. But, you know, many a time I've seen kids, oh, I want to sneeze, do I blow my nose? You know, all this stuff, all these little things that checklist that we run through every time we give a vaccine before we give it. That's my concern. I don't know. I worry about crazy things like
And it's just the education piece. and
Yeah,
also
yeah.
The tracking data. after.
Yeah,
How do you-
that's what I want to know. Where's it gonna go?
Oh,
Is it gonna?
The whole chain too, how
Yeah.
how do you know what's been maintained through?
They said that there's a thing when you open it up, she was showing it on the news, and how the box will come and what will be there, like we would have on a normal reader on a vaccine to prove, but you know what I mean? Are they gonna be as good as a like FedEx or something who delivers vaccine to health departments, has a time frame when to deliver and when not to deliver, and if they are closed, they'll take that whole thing back and ship it back to the manufacturer so that it won't go bad. So that's what I'm worried about. I don't think it will be stolen package of an Amazon thing. I don't know. I'm wondering. I just wasn't too happy about the
And Elaine,
distribution.
I think that you were also on all those emails where they were talking about the inhaled epinephrine.
Oh, yeah, yeah.
So have you,
No,
Have you run into that? one?
No.
there is,
we can barely get the injectable covered by insurance.
Yeah,
there is an inhaled epinephrine that is for over 66 pounds up. That you can, but you give it in the nose for, if you need a second dose, you give it in the same nostril. And it looks almost like the nasal mechanism that they use to insert it looks almost exactly like the one they use for Narcan.
Well, that makes sense, right? I mean,
Mhm.
mhm.
But with Narcan, you use it in the opposite nose if you have to give us opposite nares if you have to give the second
oh,
dose.
epinephrine is.
But epinephrine,
Yeah.
the same. And and there's also an issue if for epinephrine, if you have nasal polyps or if you have any, deviated septum or anything, it could be less effective.
Nose jewelry.
Yeah. But they're also coming out with a pediatric dose.
Oh, mm.
So it's, I cannot remember who the manufacturer is, but it's called Neffy, Neffy.
Lots of nice things with public health nurses is that we just keep you right up on the rest, on the topic stuff, right?
How I keep up.
Hmm.
Yeah, you should see the emails that we get, ask her.
I'm not saying all of them. I would.
Oh, it's something else, but it's very good discussion. It's very, very good discussion.
Anything else?
Not that I'm aware of. I just want to take this opportunity to say thank you to Anna and Shelby, to our two of our newest employees. They've done a wonderful job. You've learned very quickly. There's a lot of parts of the health department and you've picked up those very quickly. So thank you. And I know Shelby's also been hard at work in inspections. She's been right in, she's done many investigations already, food and housing. So she makes a great team with Dan to cover, so.
Anything else from the?
Any questions from the board?
Question. Like many people in town, I've been trying to keep up closely with town council meetings because of the town administrator turnover. And so I was watching the one about Town Day where the common victual license was given out for the beer garden. And they talked about having a Board of Health presentation recently,
Yes.
but I never saw that. So I'm wondering when that, I haven't had the time to go back and track it down. They didn't talk about, they just said recently.
Which date, yeah.
Yeah,
So I can find the exact date afterwards, but. so
okay.
It was relatively right before. It was right before I went on vacation, so that would be like middle of June-ish.
Okay.
I'll find the exact date.
Sometimes they mean health department. and
Okay.
They
Yeah.
intersperse Board of Health
Yeah.
and
Oh,
Health Department,
yes.
Health Director.
Well, they probably,
The language might have been incorrect,
Oh,
whereas maybe they
But was
present,
it our department?
it
Was,
was our department, yes.
okay,
so they present to him, but
Yeah,
not.
not to us.
I see.
So the presentation that you're talking about was to town council. So actually Jonathan Chines, our liaison, had reached out to us. So our alcohol regulations in town are a little bit out of date. The council actually is town council is also like liquor commission here in Wakefield by charter.
Okay.
So they're the ones that set the regulation, kind of like you guys do for health, they do for liquor as well.
Okay,
So we've been looking to do kind of like a review of the alcohol regulations, and it's been talked about for a few years, but we really haven't had a lot of traction. But now this specific mix of counselors has been very interested in updating the regulations. So
okay,
they asked Liz Parsons actually to come to, Liz Parsons is our substance use prevention coordinator in our
okay,
so she specializes in substance use prevention, in education, that sort of thing. So they invited her to come. She's also actually got a lot of experience in alcohol policy nationally. So she used to work for the National Alcohol Policy Institute. So she came to the town council. I was able to attend virtually. We did a small presentation to the town council, mostly to go over, higher level things like, tips training for servers. We talked about having age requirements for servers. I believe the current one is that 18 or older can serve. Obviously 21 is drinking age. So, we talked about like some of those discrepancies. We talked about hours limits. So a lot of different parts of the regulation that the council's interested in addressing. And so we talked about it from a public health standpoint. So the council then came back to us and said, we'd like you to help convene kind of a larger stakeholders group that includes businesses, that includes, Boys and Girls Club, nonprofits in the area that have an interest in, youth health and adult health. And even the chamber has been very involved. So we're trying to convene this group to talk about regulations that make sense to improve public health from an alcohol standpoint, but also take into account, like how that affects businesses and everything. So that's likely the meeting that was talked about. I can give you the exact.
yeah, I'd like to see the presentation.
Yeah, sure.
And I was kind of surprised that it was so easily approved, considering it was brought up that the Board of Health just spoke quite adamantly about, this topic. And early in my first career, I was a tips trainer. So I understand that there's, guidelines and protocol that you want to be careful for, particularly in a big open environment and event like that. So I was kind of surprised. So I would like to watch that presentation. I'm also wondering if there's going to be a presentation before the town council or any group in town, can we get an email about that so that we can attend? I guess, Anna, that would maybe go to you or Sherry, I'm not sure, but just to be, aware there's gonna be a presentation, I would have liked to known about that and already be versed on it.
Yeah.
Thank you.
We can talk to Jonathan. I think Jonathan would be the most natural contact because he's our liaison as well. So if in the future we want to notify the board, before a meeting before a meeting that's by a health department employee, we can talk to Jonathan about that. Maybe he can reach out because he's the liaison to the town council.
Have you received emails from Liz at all about the youth thing?
She
No.
sends them to all of
I
our,
thought, I know I
she
get
sends
it.
them to the Board of Health, I
But
think.
They, yeah, it's the Board of Health email.
So do those then get dispersed to all of us or how
Yeah,
does
it
that
goes,
work?
she goes
You should be
directly.
part of that,
You should
but
be
you
a
have to
part
go
of
into your
it.
Wakefield email.
I haven't gotten an email in quite some time.
Oh, yeah, she was, yeah.
And I continue to get emails to my personal email, which I would really like that to stop. I'd like to get them to my Board of Health email. I reached out to Sherry because the last email I got was about the accept this meeting invite. So, but I've got no other emails, so I would like to get those so that I can attend.
Yeah,
Yeah,
maybe we can talk about that offline.
Okay.
yeah,
That-
we could
that
do
sounds
that for
good.
you, yeah, do that.
And thank you for sending me that Mystic Valley grant information.
Yes.
Yes, I appreciate that a lot. And I'm also wondering, could this be posted on our website? So it's
So we can have it oh, you mean like on
our town.
yes,
Yeah.
we can post it. So, posting on the website and posting for a public meeting or do you mean more like just for the?
Or just more for the general awareness on our website, so that it's
that
available
helps
to
with the
people
budget.
because,
Yeah.
yeah, that sounds great. And I think that's all I got, but thank you.
So just so you guys know, I don't know if I think I explained it last time about the Mystic Valley, but we are now going to be a public body. So just like the Board of Health, we will be posting meetings. We have to abide by the same open meeting laws. We'll have meeting, minutes, agendas, all that, the same thing goes with health. So the board will just consist of myself and the other health directors in our group of 6, basically.
I saw there's a separate advisory board for that. They're an active advisory board.
I think that's the language of like, we're the advisory board. We can't pass regulation, but we can advise.
Okay.
So, yeah, so we're more of an advisory board. Like we can make recommendations, but we can't pass regulations. We don't have charter
Okay.
Mm.
powers in any towns. So we mostly make decisions on expenditures by the grant. So the public health excellence, so the ones with the 2 new employees on there. We have been using that money for training, for, education, sort of thing.
Okay.
So more of an advisory role than a regulating role.
Actually, one other thing, because Boys and Girls Club was mentioned, I just happened to catch on a comment on a local Facebook group
Yeah.
that the Boys and Girls Club is not doing the after-school program this year. Is that?
Oh, is that true?
I just saw a couple moms mention, that sign your kid up, and then a couple people chimed in and said, no, that's not happening this year.
That's surprising.
Oh.
Yeah, I hadn't heard anything about that, so I
Didn't see
thought
it. I
someone
didn't see
might
that,
be.
no.
A huge population.
Yeah.
Yeah.
Maybe they're incorrect. I
I'd be surprised.
I was
Yeah.
feeling that same way.
It could be.
Yeah.
My kids go to Academy, which is through Wakefield Public Schools. That's sort of the other big after-school body, but
Yeah.
Boys and Girls Club is.
Boys and Girls Club is
more
huge.
affordable.
Are they doing any work at the Civic Center that would disrupt them?
And
or-
Greenwood, there is no after-school at Greenwood, so those kids get bussed over to Boys and
Yeah.
Girls.
Girls.
And Galvin kids walk over.
Yeah,
There will be some difference right now because there is a change in leadership. So there's a new CEO of the Boys and Girls Club.
oh.
I did see them mentioning that.
So I wonder, I mean, they might still be doing, maybe the information's not coming.
Yeah.
Yeah.
We'll definitely look into it, 'cause it's a huge.
I know, but because they were talking about the safety, I guess there's some conflict with pickup times between elementary and middle school. So parents are
day
saying
ends at
we
different
relied
Yes,
on that,
yeah.
Boys and Girls Club.
Like if you have one kid in one and one
And
kid in.
and then they talked a little bit about where the kids would wait, if they had to wait while they were picking up the younger children, and they mentioned in the Galvin, there was a waiting place.
Mm.
So,
Mm.
yeah,
Well, it would be interesting in finding out.
Yeah.
Interesting.
We really have a hand in after school, but it's still a really big, important program.
Yeah, if people come in and ask for those
Yeah.
resources.
Mhm. Have we, have you thought about about the 3 boards meeting together?
Yes.
Cause I know that Stoneham has new people, right?
Yes, they do. They have.
And
two
Melrose?
members.
And Melrose?
Same member.
No, no, they don't.
Oh, we were planning, I was gonna ask, if the board's interested in a September joint meeting.
Sure. When would,
Likely the 3rd.
17th is the 3rd, that's our typical,
That would be the
17.
17?
How would the board feel about September 24th?
That's the 4th. That would be fine with me.
Wednesday, okay. I can ask the other boards to see, because we have one more meeting for each board. before.
That work for you? on the tw-
on
that's-
Wednesday, September
No.
24th.
Yeah, it's the 4th
I
Wednesday in
I
September.
can squeeze it. The next day is my big fundraiser.
We can also see, I don't know, does Tuesday work for
Yeah, that, I can squeeze it.
23rd?
23rd?
Either, I could do either.
Stoneham's usually on a Tuesday.
On the Tuesday.
Wakefield's usually Wednesday then.
Um,
23rd, 24th.
I work
Okay.
until 5 in Beverly, so I wouldn't be able to do any earlier. Do they meet around 6:30?
Tuesday.
Yeah, okay, that's fine. Yeah.
If that works too, Tuesday or Wednesday. works.
All right.
This would be a
That was my next
better
hosting location.
Yeah.
location than
Yeah.
any of the others.
Yeah, for parking and for space.
Yeah, we were kind of crammed in Melrose the last time we did it. I don't know, what's Stoneham set up like?
It's a cavernous room, but it's set up kind of funny, like it's not centered on the projector.
Yeah, this is good.
Yeah,
Mhm.
technologically.
Cool.
Yeah, so, Tuesday maybe? Is that
Yeah.
23rd?
9:23.
Tuesday, the 23rd.
Yeah, 6:30, maybe same time.
Yeah, that's cool. All right. I just wanted to share, I don't think this was shared last time. Stop me if it was, or just let me talk anyway.
Yeah.
That Elaine deserves acknowledgement for her work last year on the,
Oh.
as chairperson of the board. So I wanted to say thank you for all your hard work.
Oh, you're welcome.
Uh,
And thank you for your upcoming hard work you're gonna do.
Thank you. Yeah, I'm ready. I'm ready. I have big shoes to fill as usual,
No,
but thank you for everything you did.
thank you.
So I thought that
It
should
was
be.
very easy. Anthony's very cooperative, and I think, sometimes I think my past helps a little bit because I'll understand when Anthony calls and says something, I go, are you kidding me? And he goes, yeah, but, thank you. But I think it's true, even with Marcy, it's someone new on the board who's brought in, your questions, and I love when I hear somebody else ask a question because I try to think about, wow, didn't we explain this? Or, oh, I didn't know that happened, like having difficulty not knowing the stuff, but, sometimes I think I worry too much. It's that health director hat you put on and you worry about things. And I still want board training. I did the webinar with Cheryl Sabara again, and I really would greatly appreciate maybe when we're doing the joint meeting, we can see to have the training for the board members because
Take the temperature of the group.
yeah, I think everyone would like it. It's a really good program, and she talked again. Did you watch her? I don't think you watched the
I-
webinar in July. Did you watch it?
Yeah.
I caught about half of it.
Yeah, I have it. I have a lot of it on my phone. I sat by I hate to tell you, but by the pool with my headphones on and watched it, and it was great. I really enjoyed it, but it was nice to hear of a lot of stuff that very much legal stuff that we don't realize as boards and committees, even on committees, what we're following and what we're not doing right.
Try and reach back out to her. She's,
Yeah.
I know she's very busy, but
Yeah.
I'll reach out to her again and see if we can get something on the books. Maybe for the joint meeting, but
Yeah, and I think you can do the actual board training like we used to do. I taught at it. It was in person, but I think she does it online now for that. But even if she could come, I think it's even a good program sometimes to have her there to explain to town administrator and to a lot of other people in town that are interested, what exactly is the board's job? What is our purpose and what do we do?
Yeah.
It helps sometimes. But it helps to understand about every committee and what they're doing and rules and regulations we have to follow. That's what I get for taking a day at the pool to listen to a webinar.
doesn't sound like time off. It sounds.
Yeah, it was time off. It was
We're still working.
time off. I was working.
You were wearing sunglasses, right?
Yeah, no sunglasses. I was underneath the little shaded pod where the tables were, so nobody was there.
It just so I don't forget, it was June 9th, was the.
June 9th, thank you.
Yes, it was, I think we might have been like the third or fourth item on the agenda. And it was Liz Parsons in person, it was Chief Scory was in person, and
Yeah,
myself.
he was there.
Mm.
Just a regular thing.
Anything else? Anybody feel up to making a motion to adjourn?
I'll make a motion to adjourn.
Anybody want to
Second the motion to adjourn.
All in favor?
Aye, Silva.
Macaulay, aye.
Linehan, aye. So moved. We will adjourn at 7:25.
Next meeting will be what, September, to be announced. That's all. right?
No, it's the September 23rd tentative date.
Okay,
Yep,
Thank you.
6:30 PM. Great.
sounds good.